Welcome, everyone. We are at the Staysh Local One News. Great topic today. I'm joined by Leslie Walker of Gateway Center for Rural Excellence and Health and Dr. Ken Milne, who is also the chair of rural medicine with Gateway. And we're going to talk a little bit about a lecture series at which Dr. Milne is going to help us navigate what's real, what's not, as you try to figure out what's real, what's not, with all the stories and myths out there. It's good to go to someone who has the real idea. Dr. Milne, Leslie, welcome.
Good morning.
Thank you.
Leslie, I'd like to start with you. Gateway Center for Rural Excellence and Health. What a treasure to have this organization in our community, research-based. The work you do when we're in a rural setting, why is it so important?
Oh, it's hugely important. I think we're seeing, especially these days, a real disparity in health, education, nutrition, all sorts of different issues between urban centers and rural centers. So by having a place with a rural focus, I think that really changes the narrative and helps move a lot of these issues forward and brings them to light. So I think it's great that we've got a community-driven center of excellence in a place like Goderich, Ontario.
Community driven. And of course, you look after a pretty broad region. You really affect that way.
Mm-hmm. We're hoping to be the top center of excellence in rural health in Canada. So we've got grand ambitions. And so our focus these days is on Huron County and on this region. But I think a lot of the research we do is applicable nationally and internationally to other rural regions as well.
It is very heartening to know that we have some of the top research in Canada and the top researchers and thinkers around, and it's applied to our community. That's really heartening. So I thank you for that. And for this lecture series that you've put together, I'm going to turn now to Dr. Ken Milne. And Dr. Milne, you are the chair of the Rural Medicine for Gateway, but you're also an emergency physician at South Huron Hospital, and you're also a professor, adjunct professor at the Schulich School of Medicine and Dentistry at Western. So you know what you're talking about, I get the sense.
Well, I think you could have just shortened the introduction and said, hey, we've got a nerd and he's going to talk about some science here.
I like it. Nerdy science. I like it.
But I really like what Leslie said about, Gateway being the center of excellence. And I have been involved with Gateway for over a decade, and they are creating rural ACEs, rural academic centers of excellence. It's the premier research for rural health. And how are you possibly going to provide the best care to patients based on the best evidence? Because that's what we want. We want really evidence-driven care if you actually didn't do the research in your own rural community. And usually it's extrapolated from urban environments. And I don't think your listeners need to know that there's a difference between urban and rural populations. And so we want that information to inform us as clinicians, because you mentioned, I'm a clinician, I'm an emergency physician. I want to know, is this the best care for this patient in this rural environment? And so, Gwen Devereaux, what she's done with Gateway, that's our fearless leader. We follow her because of her vision and passion for getting care to patients, because rural patients deserve and expect the best care. End of statement.
That's terrific. And, we've heard from one of your colleagues, Dr. Wayne Caldwell, and I love his expression, his statement. If you've been to one rural area, you've been to one rural area. So again, that evidence thinking, the going right down to the details and really determining what stands out in each area. It's so important. Now, Dr. Milne, you're about to do a lecture. You're part of this online virtual series. You're talking about the mesmerization with evidence-based medicine. Talk to me about that. What does that mean?
Well, I pulled out a story about Dr. Franz Mesmer, and that's where we get the term mesmerization. And COVID has been really hard. That's everybody knows COVID has been a really difficult situation, but I like to turn these things into opportunities. And this is an opportunity to talk about, how do we figure out what and who to believe? Because we are getting a tsunami of information about COVID. Should I take this vitamin? Should I get this medication? Should I go on an antibiotic? But it's a virus. What about the vaccine? Oh, and to be clear, my position on vaccines is vaccines cause adults. So yes, on vaccines. So, I thought it was a real opportunity to address this infodemic, this tsunami of information, and give the audience, because this is going to be a lecture for people in Huron County and beyond if they want to join in, to figure out how can I be a good consumer in a way of information? How do I know what and who to trust? And there's that famous story about Franz Mesmer, Dr. Mesmer, German physician, highly, highly popular 200 years ago. And he came out with magnet therapies to help people. And people were mesmerized. That's where we get the term mesmerized by Dr. Mesmer. And he would use magnets to help people's ailments. But he had one really, really famous patron, and that was Marie Antoinette. And she was spending lots of money and time with Dr. Mesmer. And King Louis the XVI of France wasn't too happy about all this time and money being spent with Dr. Mesmer by Marie Antoinette. And so he had a trial designed by the leading scientists of the day. And one of the leading scientists was Benjamin Franklin. Benjamin Franklin came over to France and said, is there anything to this Dr. Mesmer treatment of magnets? And so what they did was they treated the patients, they had the magnets, but they put a blindfold on the patient. So the patient didn't know whether or not the magnets were present for the therapy or not. And what they found was there was no difference with regards to outcome, whether the magnets were there or not, if they put a blindfold on the patient. And this is where we get the term, and I'm sure many of you have heard this, it was a blinded trial. It's because they put blindfolds on people. And so I want to give people sort of tools to say, how do I know? Well, if you're reading something in the press and it says this was an unblinded trial, you should go, I'm more skeptical. That could be a placebo effect. Don't know. Oh, that was a blinded trial. That's what I should be looking for. Check mark, higher quality evidence.
That's wow. I'll be tuning in for this one. And you hit on one of our nerves here at Full Pop at LocalOne, which is if there's any magnet we're drawn to, it's credible sources and credible information. And it is always great that we know that we can turn to leading organizations like Gateway to get that. And Leslie, if I may ask you, how will we be able to tap into the series? How will we be able to see Dr. Ken Milne talk about the mesmerization of evidence-based medicine?
So you're able to register for the session if you go to gatewayruralhealth.ca, or just a quick Google of Gateway Center of Excellence should be able to pop it up. You'll register and then you'll be registered for all the sessions. So you're free to hop on whichever ones you like. Sessions are meant for adults of all ages. There's no kind of pre-requirements to join, and they're free as well. So might as well. They're at the first Tuesday of every month at lunchtime, 12 noon. And so if you're free, then that's definitely a great option to join.
Well, I certainly will be watching. I'm mesmerized by this conversation in a good way. And if I were blinded, Ken, I'd say great. Ken, last thought.
I don't want to think that, I've told everybody what's going to happen. I have 6 things to how to stop BS health, not to stop, but how to spot BS health claims. And so if you want to learn how to spot BS health claims, tune in and I'll give a presentation about this whole idea of evidence-based medicine and how to spot BS. And then afterwards, we've got this great panel and we've got a local pharmacist. She is fantastic. You think I'm good? She is like Kristen Watt. She's going to be joining the panel to talk about this as well. So I'm excited to be there.
If I may, we do have quite the all-star panel. We even have John Grace, Mayor of the Town of Aldrich. And so
you didn't tell me that. Now I'm nervous.
Yeah, exactly. Now pressure's on, Ken. And we also have Patricia Robinson, a local nurse practitioner. So it's really, truly an all-star panel. with Ken as well.
And well, that's perfect because we deserve that. We deserve to have the all-star panel for
And
an
it takes a
all-star
team.
area.
It takes
That's
a team.
It does.
Well, I'm looking forward to this team, this panel, this conversation, and I want to thank you both for your time and for your contributions to rural medicine and rural research. It's so important, and we're so, again, heartened that we have this expertise in Canada right here at our doorstep. So thank you to you both.
Pleasure.
Thank you very much.
Everyone, we've been talking with Leslie Walker of Gateway and Dr. Ken Milne, whose lecture series will begin, his segment of the lecture series will begin on the mesmerization of evidence-based medicine. Let's cut through the BS, as he says, and let's find out how. Everyone, hyper local for you always here at the Staysh.